Professor Kehlet, we are very happy to have you here in the ORTHOPARC. You are the father of fast-track surgery, and we are performing rapid recovery surgery here as well, and we have several questions to you. Is rapid recovery good for every patient with total hip or knee arthroplasty?
The short answer is yes.
Why?
And probably even the most sick patients have the greatest benefit of these programs to enhance recovery and reduce the risk of complications.
Main theme is that the patient gets up from the bed after 3 to 4 hours. What is the benefit for the patient?
Well, if you think back in the old days where people stayed a long time in hospital, there was a risk of lung infection and also thromboembolic complications. And one of the factors leading to those complications was postoperative immobilization. The bed is the worst place to be in after an operation because it increases risk of complications. So the benefits of the early mobilization has been documented. You improve your muscle function, your lung function, decrease risk of thromboembolic complications, etc.
We know that in Denmark, the people after knee and hip arthroplasty leave the hospital after 3 days. In Germany, it's still 12 days or even more. Why?
Yeah, that is difficult for me as a visitor to answer, but I think I know. In Denmark, we have, because of the healthcare system, we have shown the data on a national level. We have investigated why patients stay long in some places and not in others. And we have shown the reasons, and we have had meetings in Danish Orthopedic Society, Anesthesia Society, and with the orthopedic nurses. And this process with information, presentation of data, has changed the whole country. I don't know what you are doing in Germany, but we have shown the way forward to do it. I think in Germany it's probably because you have so many traditions involved in your healthcare system with rehab centers, etc. And we have changed that in Denmark.
Okay.
Yeah, but it has taken some years.
You documented very well the benefit for the patient, but there's also a benefit for the insurance company and even for the government.
Yeah, I will stress that from my point of view, I have tried to develop these programs for the benefit of the patient. But if you succeed and have fast recovery and fewer complications, of course the society, the insurance companies and the government, they will save a lot of money. And this has been documented in several types of surgery. So it's the benefit. There are two benefits, and it's very rare in the healthcare system that you can improve quality and reduce costs. This never happens.
It never happens.
But it happens in fast-track surgery.
Great. So when I see it is evidence-based medicine for the patient.
Yes.
It is good for the government. It is good for the health insurer, for the insurance companies. Why it is not established in Germany? Why don't we do it? Well, you are from Denmark, but what's your opinion?
Yeah, first answer is that you have to ask that question to yourself. But I think it's probably because you have different healthcare systems in different regions, and you don't have data available. So it's difficult to start the discussion because you don't have the data. If an insurance company had data to show that people in this or that place, that they stayed 3 weeks in hospital after a knee replacement, that's a good start of the discussion, because then they can show data from other places that is totally different.
Okay.
And then you get a professional discussion which is positive and constructive. I don't know if you have that in Germany, because for me it is a big surprise that in contrast to other countries, Germany is lagging behind.
Yes,
Yeah.
I think so.
Yeah.
Okay, so we have to produce the data and we have to present them.
Yeah.
So,
and also the insurance companies and the local governments should be aware of the data to have this shared discussion.
Okay. What can we do that the government is going to listen to us?
Well, you can invite me and I will try to discuss with them. I have done that in UK.
Okay.
In UK, the government has really got in and monitor what is going on in fast-track surgery.
Okay.
They started in abdominal surgery, and this has been very successful.
Okay.
So
you are here now, so probably we are on the right way.
I would say that because I'm an abdominal surgeon, that about 10-12 years ago in Charité, in the visceral surgical department, they visited us and took it up.
Okay.
And they have spread the message in Germany in colonic cancer surgery, for instance. So they have been quite successful to change the system.
Okay.
The problem is that the German system has a limit for the shortest length of stay.
Yes, that is a problem.
That means that if you go lower than that, you are punished. And this makes no sense because it stops the improvement and development. So that has to be changed.
Yes, I know this. When a patient is going to leave too early. Rapid recovery is a learning system. What is the main issue you are working on at the moment?
Well, I work in all surgical specialties, thoracic surgery, vascular surgery, orthopedic, everywhere to try to improve. And we always start the discussion by asking, why is the patient in the hospital? Because then you find out what are the problems. Is it pain, or is it nausea, vomiting, or what is it? And then you dissect down and change care. And then you show the data improvement. So it's always the same process. Ask the simple questions, get the data, change your care, look at the data again, change, etc.
Okay.
So it's a dynamic process. I mean, what we have of rapid recovery programs today will be different in 2 years' time.
Okay.
I'm sure because patients still have some problems after operations, like cognitive dysfunction or risk of other complications. So it's a dynamic, scientific and practical process. And this is why it's so interesting. There's a lot of psychology into this also.
Yeah. No, it's interesting.
Yeah.
You told that you went to England to present it. How long does it take in England from your presentation until they put it into the government?
Oh, it has also taken about 5 years or so, and it is not finished.
It's not finished.
In no way finished.
Okay, so
it's the same in Denmark. I mean, it's also a continuous process.
Okay.
But in Denmark, we are lucky that we have a national healthcare system, so we can monitor every operation in the whole country. So it's quite easy to get it there. Yeah.
Okay, Professor Kehlet, I thank you very, very much. Yeah. We are here in Germany at the beginning, and I hope this was the start now. Thank you very much.
But I would say that Germany is so interesting for me because the level of surgical expertise in Germany is very high. So you have a very good start.
Okay.
That's my experience. So that's why I think the German situation is very interesting in rapid recovery, because you have very good surgeons.
Okay. Yeah. Thank you very much. Then we must do now the rest.
Yeah.